Good evening, Chair. Detective IP Birungi, CI Data Juice Committee.
Officer, are we done? Yes, accounting officer.
Thank you very much, Chair. I'm called Dr. Andrew Du, the accounting officer for the Regional Referral Hospital. I'm here with a team. With your permission, we'll quickly run through those who are available here.
Good afternoon, members. My name is Peter Okelo Deke. I am the Principal Hospital Administrator, Lira Regional Hospital. Thank you.
Good afternoon. I'm Tino Harriet Okelo, Pharmacist, Lira Regional Referral Hospital. Thank you.
Good evening, honorable members. My name is Felix Ogwang, the hospital accountant. Good evening, Chair and the members. I'm William Biarohanga, Head Internal Audit.
Good evening, members. My name is Juliet Ato. I'm the Principal Human Resource Officer, Lira Regional Referral Hospital.
Good evening, members. I'm Akelo Monica Oyet, Senior Hospital Administrator, Lira Regional Referral. Thank you.
Good evening, honorable members. My name is Sebastian Joseph, the Procurement Officer, Lira Regional Referral Hospital.
Good evening, honorables. I'm Ikoba Alex, Assistant Accountant.
Good evening, honorable members. We realize it's not late for work, but tomorrow is Eid. But that can't stop us from handling our duty of the mandates that we are given as members of Parliament and the Public Accounts Committee for scrutiny on the funds that were given to Lira Regional Referral Hospital for the year 2024-2025. Accounting Officer, I want to welcome you to Kampala. I believe the roads are good. We thank God that you've reached safely, and we pray that we have a brief engagement. I thank you for bringing these so many 3 ladies on board and on the high table, because normally your colleagues come with the ladies, but the ladies are behind, the men are in the front. Things have changed. These days, the fact that the chair is a woman, my dear, things are a little different. So,
Chair, you can interest yourself how they are sitting.
So
1 to 2, 1 to 2.
The ratio is they are well spread. 1 to 2, 1 to 2, well balanced. My name is Gorethi Namuga. I represent the people of Magola County, that is Sembabule District. I'm the deputy chair of this committee. The substantive chair is in prison, and this happened after elections. So we need your prayers. The fact that tomorrow is Eid, we are not going to have so many hours of this engagement. However, it will depend on your responses. For us, we can be here till morning, as long as you fail to meet the expectations of the committee in regard to the response to the matters that were raised by the Auditor General. You are going to give us an update of the current status of Lira Regional Referral Hospital in terms of number 1, staffing, number 2, bed capacity, number 3, your budget for the last 3 previous years, for us to see whether it is adequate. Then update us on the machines maintenance budget, because we realize it's been a challenge across the entities that we've so far interfaced with. Then you will also update us on whether the services are free, because our assumption is when one comes to Lira Regional Referral Hospital, we get free services. So you will tell us those that are paid and those that aren't paid for. Then also update us on the status of your private wing. Do you operate a private wing that side? In case you do, please update us. So with those few remarks, kindly have some 5 minutes of the introductory remarks and also respond to those areas that have been raised. But don't forget to speak about the neonatal unit. If you have one, give us an update. We need to know your capacity of the ICU that you have, the intensive care unit. and also your theatre, the status of the theatres that you do have, and whether they are adequate or not. Do you have a mortuary? If you have one, kindly update us. Moroto was here last financial year, and they had a mortuary that would carry half a body. So hope your situation is different. Thank you.
Thank you, Chair. As I said, I'm called Dr. Andrew Udu, the Acting Hospital Director for the Regional Referral Hospital.
Acting? Acting?
Yes.
For how long have you been in Lira?
In that capacity, 1 year.
Were you the accounting officer for the financial under review?
Yes.
You are the one?
Yes.
So the other time you were substantive. Now you are acting.
No, the other time we appeared with a former accounting officer. Yes.
So you were the accounting officer for their under review?
Yes.
Okay.
Greetings from Lira Regional Referral Hospital. I will, right now we have 320 staff employed by government to the Regional Referral.
100?
320.
320, okay.
Yes. So
Versus?
Versus 1,172. So that gives us a current staffing of 27%. Our current bed capacity is at 456. Of course, with very high bed occupancy rate of about 108%. I will skip the budget part as we get the actual figures. Now, the services that we offer at Lira Regional Referral Hospital are free, and there are only a few that are being offered under the private services, and that includes dialysis, CT scan, and other services under operations, major operations. There are some orthopedic operations that at the moment we don't get supplies under national medical stores. So for continuity of service, we then find ourselves having to procure some of those items through private wing. We have a neonatal unit, and our neonatal unit is a 30-bed capacity. We are able to admit up to 30 newborns to neonatal unit. Recently, we received equipment from Ministry of Health to support the neonatal unit, and this will move us from level 2 neonatal unit to level 3 when all the equipment have been installed. We have actually one pediatrician undergoing training for neonatology right now at Mulago National Referral Hospital. So we hope after completing that special training in neonatology, we'll be able to better manage the neonatal unit. We
so is this, with the capacity of 30 beds, is this one adequate for you?
Of course, it's not yet adequate, the 30 bed, because at some point you'll find babies sharing beds. So I think a capacity of about 60 would fit for now, 60 beds.
What is the ratio of patient to nurse in the neonatal?
We have in total about 12 staff within the neonatal unit, and they're able to work for now with support from the students under training and the rest of the staff fairly, but that number is still not adequate for the 30 plus babies, because the admissions of 100
What is the ratio and what would be the ideal ratio?
I think the ratio is about 1 to 3.
Then you're okay, fair, okay. Because your colleagues were at 1 to 10, 1 to 20.
Yeah.
So for you are faring okay, you are faring well.
Maybe, Chair,
Yes.
are those
But
ones
is-
working on shift?
Yes, they're
Or
working on
out?
shifts.
No, you know, because if they are working on a shift or in a shift, we need to know how many nurses do you have in a shift,
Yes.
because that's when we can ascertain the ratios.
Mm.
Don't lump it up, because we want to know every time I come for a service, how many nurses are available.
To attend to.
Yeah, would attend to the babies. That's what we want to know.
And what is their shift?
The shift
How
is
many hours?
is 8 hours. It's 8 hours shift.
So what is the right ratio? Because this 1 to 3 might not be realistic. Remember, we shall come to Lira. The people of Lira will give us the actuals.
Yes.
You will give a false picture here when it's different home. If you give an impression that the neonatal unit is okay, when it's not the case, it is a disservice to your people. So make sure you speak to facts.
Yes. Thank you, Chair. We'll collaborate quickly on the final figure.
If there is anybody on this team that is directly responsible for that area, please, you can delegate to any of these ones to answer on your behalf. It's your right. That's why you moved with them.
I don't have
don't
somebody
have
in
any?
the pediatric department
Okay.
here. Yes, I would therefore go and speak about the dialysis. We have 5 dialysis machines in the hospital. One machine is dedicated to patients who are infected with hepatitis B, so which means the general population of patients with chronic renal diseases now have to utilize the 4 remaining dialysis machines. Dialysis was established in 2023, and our average sessions that we provide per month is up to about 200 sessions that we provide to the dialysis patients. The 4 are not adequate. In fact, we have already written to our sister institution, which is Chirudu, to ask for additional support. We have asked for 4 more dialysis machines to supplement the current one that we have.
Okay.
So we think when we have that added, at least will relieve us from the pressure. The theater has 5 operating rooms. The 5 operating rooms are not adequate because right now we have very many specialists. We have up to 19 specialists at the regional referral hospital, and those in the surgical disciplines are quite many. We have a pediatric surgeon, we have the general surgeons, we have the orthopedic surgeons, and each of these, the gynecologists, the ENT, all these specialists require particular days to work. When you combine with emergencies, it's not adequate to provide the service and the turnaround time. So that space is inadequate for the
What
volume.
would be the adequate space? What's the gap?
I think right now,
Don't think.
when you look at the volume of patients, because every year we operate up to 10,000 patients.
What is the total population of the whole referral?
The
target population.
regional referral serves a population of 2,650,000. So when you look at the surgical burden is high, and we think operating rooms of up to about 8 to 10 would help us. We do have mortuary service. Our mortuary has refrigeration capacity of 12 bodies. Of course, looking at the number of patients who come in, but also the Lira city does not have a dedicated mortuary of its own, so it overwhelms our capacity within the regional referral, and that is an area that we think can be improved in the future.
Okay.
Yeah, so I think let me allow PHA to just add something small on our...
You couldn't speak about the ICU, the intensive care unit?
Oh yes, the ICU, we had a challenge with our ICU because we have 8 ventilators. But at the moment, 3 are functional. The challenge we had was that because we did not have an anesthesiologist on station, but for the last 6 months we have been able to onboard that critical care specialist who is able to provide that much needed support for operationalizing the ICU. So right now we are able to admit patients in our ICU. Although the room dedicated for ICU can only take 4 beds,
So
which is 4 ventilators.
So the current capacity is 4 beds?
Is 4 beds.
Fully functional?
Fully functional.
What would be the appropriate capacity?
I think the appropriate capacity would be up to 10 beds.
No, when you come here, you don't
Yes.
think.
Is 8.
The reason as to why you don't think is because you have a strategic plan
Yes.
for that referral hospital. So you must speak to facts.
Yes, up to 10 beds would be adequate to operate for that population.
How many deliveries do you make a day?
We do have 800 deliveries per month, so that's about 25.
How
Per
many for C and normal?
The cesarean section rate is 30%.
30%.
Yes,
To you as a medic, is that normal?
it's normal for a regional referral hospital because we receive critical mothers from the entire region. WHO recommends 5 to 15%.
How many districts do you serve?
We serve 10 districts.
Okay.
Yes. So, thank you. PHA can add something.
Thank you very much. In brief, for the finances, 2023-24, we had a wage allocation of 10 billion.022, and non-wage was 8.5 billion. 2020-2024.
So that is a total budget of how much? Give us the total.
That is 18
billion.
5.7,
Okay.
something like that. Then 2024-25, it remained the same. There wasn't any big change. At again 10.022 and then 8.568. In 2025-26, it still remained the same, but wage gotten from 022 to 10.027, and then the non-wage was at 8.85. We are projecting in the new year, we have had an increase in wage. That is for the year 2026-27, the year in plan. We have had an increase in wage coming now to 14.83, and then the non-wage has risen from 8.8 to 10.3.
On average, how much is your capital development budget?
What we have is called retooling, and is been running at 108 million.
108 million. Do we have any areas in electricity, utilities, electricity and water?
Yes, we do.
Yes, we do. We do have areas in utilities. I think that's about. It's 586 million, and this has been declared.
It has been cleared.
Declared.
Declared.
Declared. Yes.
Okay. Can you break down for us to know which belongs to electricity and water?
All that figure is water.
All this figure is water.
Yes.
Electricity,
we don't have areas.
You up to date. So 586 billion. Million.
Yes.
For water. What is your annual budget for water?
About 420 million.
The budget for utilities, and this is water, 420 million. Do you think this is affordable? Is it manageable? Microphone.
I'm saying it is not manageable, but probably one thing to note is that the 586 was something accumulated over time. And then now the allocation of the 420, that is for water, and then 400 for electricity, tends to suffice for now. But definitely there will be need for an increase, given that new developments are coming in place that will need more power and water. Thank you.
Yes, Honorable Elijah.
Can I just find why we are at zero areas in terms of power, and we are up to date with we're up to date with power and not water? What could be? And then your population catchment area.
Population, you said it's 2.6 million.
Yes.
Okay.
Please, Honorable, say that he responds once.
Okay, mine is on welcome Lira. You used to handle nodding disease. Could you give us the status of nodding disease? Do you still have patients? And what is exactly happening? And what is the status of nodding disease in Lira regional referral?
Okay. Thank you very much, Chair. For electricity, we have had credit prepayments. So this has been, we have not been having much to require from the running budget. We have had prepayments in credit for electricity.
That's your own innovation as Lira Regional Referral Hospital, or it is for all, was original hospital?
Yes, PHO.
Honorable, there was a communication and agreement between Ministry of Finance and also Ministry of Health in terms of giving in power for the facilities, and that's when the issue of prepayment was brought in. So the monies for the utilities, call it like electricity, it is earmarked, ring-fenced. Immediately it is released, we basically pay it to UMEME by then, which now is UEDCL. So in that process, we were able to find that our money was available with what? With the UMEME. Because we would basically receive it and pay straight. Then we get into reconciling our consumption.
So what would be the reason that other regional hospitals have areas? So they did not take it up. But that's for them to answer.
Honestly, for Lira, that's what we took on, and that's what we are doing. Thank you, Honorable.
Yes, Honorable.
Thank you, Chair. Why are they not doing the same for water? Because we would have also realized that the cumulative areas wouldn't have been that much if you were doing that, even if you were given little. Why are you not doing the same?
Thank you, Honorable. For water, we have a number of meters within the hospital. We do have some meters actually with credit, despite these areas. So the consumption for some meters are not like others. What we have done recently is to request National Water to reallocate the credit that is in 1 meter to a high consumption meter, so that we exhaust the credit. Is no use to have credit and yet to have high expenditure on water on some other meter bills. So, but also why we do have that much underwater, we have had an increase in workspaces over the years, and the consumption also gone up.
The nodding disease?
Oh, yes, the nodding syndrome. Thank you very much. For the nodding syndrome, I think what happened over time was the number went down, and we have been getting support through through the NCD's department, and majority of them were repatriated to where they would originate from, and mainly that has been the Acholi belt. Yes.
As we go to matters audit, just give us a general picture of the services. How do you rate yourself? And because the honorable colleagues, I've been looking at the budget for Lira of 18.5 billion with a population of 2.6, serving 10 districts and one city. Lira is 18 billion. Masaka Regional Referral with close the same population was at 14 billion. We are looking at the rationale of what is the basis of allocating different referral hospitals some of these budgets, because we realize there are some of you with a minimum population. What is so unique? Because we realize that with this population you ought to have been getting less. We had Naguru Regional Referral Hospital, the China, is this the China Friendship? The China Friendship, that one. They had a budget of 13 billion, but they had a population of 4 million. So what is so special with the Lira for you to have, because it looks as if this budget is adequate for you?
Thank you, Chair. The budget is still not adequate. I think what brought the difference is that Lira, part of the 18 billion, about 3.8.
Who is the MP for Lira City? I just want to learn from you.
Honorable Jimmy Akena.
Honorable Jimmy.
Yes.
Then who else?
And then the other for City West.
But
I'm answering, Chair, all of them. Yes, we have 3 members of Parliament. Yes. West is Honorable Ebong Yit.
Then the other one?
And then the woman member of Parliament is Dr. Jane Ruthachem.
She should have come first, the fact that you are handling her sector, because the way you were dodging, it makes us.
Yes. So, Chair, I was answering.
But we congratulate you for that privilege. It is not easy.
Yeah.
Having such a big person come from your area, you should kneel down every day and pray, and pray that God. Yeah, it is. We've had a president, so it is not a big achievement to have a minister. But also maintaining the status quo is not easy. You can be with the president and remain without. But let's proceed.
Yeah. So thank you, Chair.
I'm not saying that this is the reason as to why you are well funded, but
no, we have actually very good reasons why we got that much. We had a G2G funding, government to government under USAID, that was contributing about 3.8 billion shillings per year. Yes, so you know that funding was transitioned now to government of Uganda. Government had to come in and support that equal budget. Lira Regional Referral has among the highest number of HIV patients enrolled into care, up to around 12,000. 12,000 if you compare with the rest of the regional referrals. So to care for this population required much more investment. Yeah.
Okay. Do you have a mentor unit?
We do have a mentor unit.
You know, Butabika was here and they were complaining that the reason as to why they are very congested is they handle most of the cases from your areas. So if yours is somehow operational, it's a plus for you. Make sure that we decongest some of these national referral hospitals, because Butabika is very, very overwhelmed by the numbers. So once services are adequate that side, the better. I asked for how much do you charge for C-section, normal delivery, for mothers who come to your unit?
Thank you, Chair. We do not charge for deliveries at the hospital.
So to the people of Lira, as long as you buy a Benson and you have the clothes for your baby,
yes,
move straight.
It's free
Not
of
move
charge.
straight, but as long as you are referred, whichever way walk straight to Lira Regional Referral Hospital. If you require a C-section, the doctor will just take you to the table. As long as you've been taken through the preliminaries of preparation. We've been having challenges of corruption in our hospitals, you are aware. And they are not as free as we allege. So let's pray that you are giving a true picture of what transpires in Lira Regional Referral Hospital. If not, let's put mechanisms to mitigate. Because we are told you are not the poorest region. Northern is not the poorest. The poorest is Busoga, I think, according to the statistics. The poorest is Karamoja. You need to look at it properly. But when you come to Lira and the districts that you serve, those are the areas where people still line up for 1,000 during elections. Somebody can vote a candidate. We are just bringing facts. People line up for 1,200 to give votes. You see? So if it is that kind of high levels of poverty, because the northern region is in the statistics, you are the highest in levels of poverty. That means we expect our people to get access to free medical services where we can afford. And the beauty is most of you come from those areas. I kindly request that where you can afford to give a free service, please do. Do extend that sympathy to those people, because we know how poverty is in that region. So please, if there are some of our colleagues who charge some money, but even our worry is...
Chair.
Yes, Honorable.
Thank you, Chair. Chair, much as the accounting officer is saying that even C-section is zero, I'm aware that every woman who goes in there is charged money for professional fee for the doctor who is handling. What happens in Lira? Because in all hospitals that I've been to, there's some amount of money that you pay as a professional fee for the person who is handling that operation. And we've lost a lot of lives because of that kind of payment. When you don't have, you can't be taken to the theater. You have to look for that money before you are taken to the theater. So how come that you are doing it really completely free?
Thank
We
you,
want
Chair.
to learn from you.
Thank you, Chair. We understand very well the background of the kind of people we are dealing with. When you go to the hospital, we have put placards on every wall about receiving money illegally. And we have sensitized the population through barazas that when you come here and you encounter such a misfortune, you must make sure you report. So, to state clearly, we do not have any charges for delivery.
Okay.
And I think the patients are the best judge. Yeah.
Chair, also
Yes, Honorable.
there is this laboratory that was launched in October 2025. What is the status of that wellness laboratory?
Thank you very much, Chair. We are among the first regional referrals to launch a wellness laboratory and clinic. And this was done through support from Ministry of Health, but also in response to the high burden of non-communicable diseases, even among the staff and the people within the city of Lira. That wellness laboratory and the clinic has now served very many people. In the first month of October, we served up to 2,000 people that receive service through the wellness clinic and laboratory. We have now been identified to scale it up to the rest of the regional referrals through the efforts of the Director General, and we think it's a good service that we must protect and expand to the other facilities. So it's going on very well. We are now only working around how we reach out to the important category of patients who are the corporates who do not have time sometimes to come to the hospital, but we have a deliberate strategy to see how we can reach out to them and open even clinics within a weekend for them to access. Thank you very much.
Do you also experience challenges of power outage in your area?
from last year March, through the support of government, we received a dedicated power line for Lira Regional Referral. So since that time, we have not had a major power crisis. It has been very impactful for managing our sophisticated machines, but also continuity of service. Yeah.
So, how is your private wing?
The private wing.
It's very small.
The private wing started in 2023, and as a strategy for generating local revenue, we have had a number of strategies to expand revenue generation. We repurposed building. We do not have a dedicated structure at the moment, so it makes it a bit difficult to have all the services in one place. So it's scattered.
So for now, we don't have a private wing.
We do have a private wing in a repurposed building. Over the years, our revenue has been increasing because we have increased some of the services that should be going there. And also recently, the URA has the generation.
Okay. Yeah. Honorable colleagues, we are going to go straight to 1.3, payroll management. I commend Lira for really they have tried to absorb this budget on statutory obligations, save for this 200 million and absorption of this 200 million. What is the explanation for this? Non-payment of these 3 staff and 6 pensioners. What happened? And Director, if there is something that you should be passionate to, is the issue of pension. You know how old age is. We have some of our colleagues here who don't believe that when you grow old, you rest. But for me, I would advise that when you grow old, please rest. So when our colleagues go for retirement, it's very unfair of us who are still occupying these offices to make them move up and down to access pension. I don't know whether the HR person is here, but pension cuts across. Every entity has challenges with pension. Our only prayer is let's be as human as possible to ensure that we handle our colleagues very well. Let's clear pension. Let's not have, you can have areas in anything, but it shouldn't be pension. Because, you know, it is little money, but it is very, very, very needed to the person who is a beneficiary. You see? So it is bad to make your colleagues move up and down. People have died out of failure to get that little money that they worked for. So please, statutory obligations in the line of pension and gratuity must be mandatory and should take the first priority. We can accept exceptional circumstances where you fail to handle the transactions in time, but where you can, please just make sure that statutory obligations make the first call, and I mean do it in time. But we commend you for, at least you are doing well. When you look at this 97, 98, 100, but we want you to have 100 across, because you have the money, you have the staff, execute. So why did you fail to utilize the 200?
HR.
Yeah, thank you so much, Chair. Why the money was not utilized was because if you remember last year we had Office of the Auditor General did a mass verification of all pensioners in the country. So these pensioners were not verified, and on top of that, they were now not on the system, and there was no way we could pay them pensions. So they were taken to Ministry of Public Service for verification, and we also advised them to go to the Office of the Auditor General. So we're still waiting for responses before we can put them on the payroll.
Chair.
Yes, Honorable Susan.
Thank you very much, Chair. Chair, the pensioners, the Human Resource Officer is saying were not verified. Did you bother to follow up on the people who worked, whom you knew? Because if they didn't come, at least there should have been an explanation why they didn't come for verification. did you bother to let them know? Because some of these things happen. Some of them are old and they are holding these analog phones that they cannot even be able to read the messages, or they cannot be able to, to get that communication like now on social media. Did you ever bother to let them know that verification was taking place and the impact of not getting verified?
Yes, we did, madam. We made radio announcements, we made phone calls, but as you know, their telephone contacts, not all of them can be accessed on telephone. But we tried our level best to reach all of them in the district, and that is why most of them came except these 3. And when these 3 came to my office, some of them were sick by that time, though they did not inform me. So what we did...
Are they alive?
Yes, they are.
How did you know?
Because they came to office.
They came, eh?
Yes. So when
you're going to provide the details, because we have 2 categories. We have the 3 and the 6. So when you look at under absorption of the released funds, non-payment of 3 staff and 6 pensioners. These 3 staff are for salary or for what?
The 3 staffs, why they were not paid, I think it's because of the delay.
Don't think. You must be sure of what you're speaking about. When you think, that means you don't have the actual information.
The long recruitment process which comes and it catches up with the financial year was the effect. But we eventually paid them.
Do you have the details of these people? The names of these pensioners? Is this an attachment here?
Chair.
Yes, Honorable Susan.
Chair, the 3 staff was because of the delays. Could you clarify, give us more light? Because if delay in recruitment, if you have asked for the 3 staff and they delayed to bring them, and now you're telling us here that you eventually paid them, what did you pay them for if they were not recruited at that time?
Okay, what I meant was the long recruitment process, whereby first of all we are not the ones who recruit. We have our recruiting bodies, which are is Ministry of Health and Health Service Commission. So by the time the adverts are done, interviews are done, deployments are done, and the officers now come to the hospital. That is what I meant, that sometimes it catches up with the financial year.
But what I'm asking is, you said eventually you paid them. Were you supposed to pay them when they did not recruit them on time? Because they came, you're supposed to pay for the service that is rendered. Now, when you tell us that you eventually paid them, that means immediately you absorbed them, you decided to pay them for the period of time when you advertise for recruitment.
So did we recruit?
No,
what is the
we don't
HR?
Pay people for
HR.
Yes.
What is the status quo? Did you recruit?
Chair.
Yes, they came.
Those staff were eventually recruited, and they're now onboarded.
You are going to give evidence of the 3? Yes, Honorable Saum.
My problem is one. Your performance was good, but now only 6 or 9 people are making you suffer. Secondly, did you give this same information to the auditors? Could you help us know that? If you gave them that information, with this performance would have been taken. And when you are appearing before here, you were invited, you were given room to prepare, you have big files with attachments, but you are not showing how you paid and evidence attached. Because the pensioners can end up taking you to court and you will pay more than 200 million. Not so?
You're going to give us an update
yes, Chair.
Of the 3 and the 6.
We will.
The status quo. Honorable colleagues, 1.32, status of the hospital structures. The auditor carried out an inspection of a sample of structures that included the hospital general store and the radiology room, and noted the following. There was insufficient storage space of the EMSH in both the general and private wing. The radiology room had developed cracks. I noted that the hospital maternity ward had very limited space, which was insufficient to accommodate the mothers and their new babies. How old is Lira Regional Referral Hospital?
Lira Regional Referral Hospital is, was formed in 1923. So most of the structures are as old as that, including where we have the maternity, the internal medicine wards and surgery wards. They're all as old as 1927, 1930, something there.
Okay.
So, and in fact, we are almost celebrating our 100 years.
You're almost celebrating 100 years.
Yes.
But not all buildings are 100 years. The building which is 100 years may be 1 or 2 or 3. So it is staggered because you started with a few, but the bulk of it increased from the 60s.
Yes.
60s or 80s.
But Rajir, I think Dr. Fyodo said it started in which year?
1923.
By then it was Lira Hospital.
It was a dispensary
for
time.
the dispensary for the entire region.
Yes.
So
well,
when
is it here that was a dispensary for syphilis?
No,
It was,
Moroto. Was it Moroto?
No, Lira was formed out of, it was a recruitment site for World War fighters.
Mm.
Yes.
Hey, that is, you have that history.
Yes.
No, it was both for Lira and Teso, Soroti. They were the same situation. Recruitment, and then Kumi was leprosy, something like that.
So, we appreciate the age of the hospital, but how far have we gone in construction of new structures?
Thank you, Chair. The hospital has a huge burden of infrastructure gap, and indeed, in our new strategic plan, we have prioritized ward complex construction, although it remains unfunded, including a store. These structures, I think, if we have them as a hospital, we'll be able to solve most of the infrastructure challenges we have. However, as we wait, we have reached out to also donors through proposals and the like, and recently we had a small expansion in space for under maternal child health that has given us additional 45 beds, but this is still a drop in the ocean in view of the numbers that we care for. For the store, we receive now quite a huge volume of supplies, and the current space, we are not happy with it. But we have had to repurpose an old structure again to create some additional space that can absorb the volume of supplies that we receive. So as I mentioned earlier, those are unfunded priorities, and we are still lacking there.
So we take note that you still have a challenge of old structures that would require renovation. Okay. Honorable colleagues, we go to 2.1, procurement management, failure to dispose of public assets. The auditor reviewed the Board of Survey report for the year 23-24, that is Appendix 2, and noted that you didn't, the failure to plan for disposals, you didn't plan for disposals. Is that true? If you didn't, that is a bad practice. But tell us about the items, but you don't have a plan. Do you have it now?
We do.
Yes, Honorable Song.
You accepted the query, and the answer you would give us here to make us, to appease us, is that he tells us now this is what I have, because at the time of the query you were very simple and good. So the auditors, you accepted, and you said plan. Where is the one you've made so far? Since then.
Yes, Chair. If you look at the appendix, all that is provided. Since that report from the Board of Survey, the disposal has happened, and in the appendix you'll be able to see the report and the process of disposal, but also an approved plan for the running year for disposal. This is something that took us some time because we were trying to plan how to execute it, but it's something that has been done already.
Okay. Honorable colleagues, we go to the budget. This underfunding, we are not going to go because it's just a shortfall of 222 million. We take note of that, but that was supposed to be under human capital. Was supposed to pay board committees and council allowances. How did you handle this eventually when you didn't receive the money? And why don't you pay gratuity?
Let me request him.
Thank you very much, Chairperson. When we are doing the budgeting over the period, the funds that were appropriated were given priority, but like the director alluded, the support we got from the G2G arrangement also had a provision for being able to facilitate some of the structures. And one of the key structures was the board. So while the other side, it was not released, the provision we had under G2G arrangement were able to clear the allowances for the board to sit. As for the gratuity pensions, that was cleared also.
Okay. The short failure to utilize the 296 million, you allude that to delays in recruitment by the Public Service Commission. You will have to give evidence of that. Performance of local revenue, that is NTR. You planned to collect 810, you collected 685, you have a shortfall of 350. What are your sources of the NTR and why didn't you collect as planned?
Thank you, Chair. We had a discussion as a management together with the board on how to improve on the NTR collections. And as I mentioned in the initial submission, there are services that we have onboarded under private wing. That includes pathology department. We have also onboarded some of the services there. Of course, dialysis. We have also now had engagement with the corporate insurance companies that will be sending in their staff to receive services at the hospital.
Yeah, how much do they
Madam
charge
Chair.
for dialysis?
Chair.
Yes, Honorable. Honorable Sawung, first then Honorable.
Lira, you are so blessed. Where people are looking for money to buy drugs from the private wing, for you had enough. That's an advantage of a minister. Nothing else. Because, Madam Chair here, the hospital, there is the correct funds negative. No. The accounting officer explained that NMS had stocked adequate drugs in the government wing, which limited the purchase of drugs by patients in the private wings. That one, anyway, it's your advantage.
Yeah.
As the Honorable Mudimi
others,
comes in, you'll have to respond to failure to remit 335 million to the Treasury. Honorable Mudimi coming.
Yeah, Madam Chair, I was coming to that. Because when you read the commentary on page 7, number 7, the hospital opened up a private wing, collected 685,000, remitted 350 million to consolidating fund. Due to pressure from clients, the hospital purchased drugs and sundries worth 335 using the collections at source. That is the 335. Now, the question I want to ask you is, normally when you spend at source, you get authority from Ministry of Finance. Can you provide the approval?
Thank you, Chair.
Yes, Honorable
Let me
Susan.
just add to that. The accounting officer earlier on told us that all services are for free. However, I'm now seeing that he's also naming dialysis as one of the services that they are getting the NTR from. Can we know how much you're charging for dialysis in Lira?
Okay, thank you, Chair. I will start from that. Dialysis is charged 80,000 shillings per session, which is among the cheapest. And then when you come to other services like CT scan, those values, the amounts were agreed upon by the Ministry of Health, and I think is uniform across all the regional referral of 150,000 for a plain CT scan. Chair, I wanted to comment on private wing. Yes, we had a collection, and running a private wing, there's usually a pressure to make sure that what we say we are providing is available, including some drugs that should be utilized by the patients, but also there are some equipment that are required for running the patient monitors and the like that should be made available within the private arrangement so that the patients are able to utilize the service. So this was a pressure on the ground, and I must say we did not get that express permission as required, but since we have matured in the private NTR collection, all collections are being managed by Uganda Revenue Authority, and we also had to do a detailed budgeting process so that this is managed properly.
But Chair, the practice, and there has been authority. Whether you've used the money, you have said out of this correction we have used this for. But if you have done it, I've seen many universities, many other places doing the same. But for you now to sit and in your office, then you decide. Is it proper?
Madam Chair, I think this is among the clients we have met here who surrenders easily and say, I am sorry, because he has accepted it is not proper. But nevertheless, you have had opportunity to have financial institutions position themselves around the facility. That should interest you not to be tempted to have cash in your safe, where you can now create situations of a few people sitting and agree to spend on priorities, which include, as among others, attending to the private wing. We agree. But when you come here, you bend the laws. So let the resources go to the consolidated fund. All we would be fighting with you here would be you collected 354, but you sent 350. What happened with the balance? And there you would be quick to tell us that by close of the financial year, the bank still had money to move. And we move on. But spending at source, in fact, you're among the first institutions here that are confirming spending at source. So since you have matured, like you've said, the journey has been long and you're maturing, I leave that at the discretion.
Touch, you just have to resist. You are only 1 year. Spending at source has been at least very few. And those are some of the financial disciplines that are fading out.
Spending at source is irregular, is illegal. It's a very bad practice. Actually, you cannot justify. You know, expenditure at source. But they used to tell us that people from the north don't lie. I've seen the first one. And if it was caught, you give somehow a lighter punishment. Though the funny part of the law, you can't compromise. But the fact that you notice that it is an error, we pray that you don't do the same. Though the punitive measures, we have no option. If you break the law in regard, the PFMA is against spending at source. So we can't do much, but the fact that you noticed that there was a gap, we believe in continuous improvement. So when you get back, kindly ensure that you remit all the money that you collect to the consolidated fund. Don't leave leakages. Sometime we shall come that side and you say money was in the safe and somebody stole it. So let's not get tempted. Let's follow the law. When it comes to issues of finances, spending at source is very outdated.
In fact, Madam Chair, he should be supported by his accountant, because at the end of the day, you and the accountant, you might sit in the comfort of the AC there, and it is the accountant who brings the money, and yours would be to ask, how did you get money? What I know, the money goes where? So you should be supported by your accountant to clean up the processes slowly. And if you put pressure on the accountant will wait for you when we come here. And say, I got pressure from there. But I know you have a professional accountant who has been growing also, like you've said, should be able to help bridge those gaps slowly. Thank you.
And this team is still very young. We don't expect you to steal at such a young age. If you start stealing at that age, will you survive? Will you reach 60, or will you get to 80 like Angura's friend? So,
what miracle happened? Because in 2024, your non-tax revenue was about 50 million. 50 million. Then 2025, 500 and plus 600. Then you transferred 350. What a jump!
Yes, PHA.
Thank you very much, members. Not just to think, but the issue is sharing the innovations. We are saying the private wing in Lira didn't use virtually to exist. Actually, the 50 million that used to be collected and remitted were monies that were paid or received from training institutions when they would place their students. Now, when we started the private wing, and I will actually say this was a baby child of the engagement between government of Uganda and the government of the United States, which brought in what we call the G2G arrangement, government to government funding, where after the hospital was able to meet the milestones, that money that could have been shared out, we planted it to say, let's begin a private wing. And that is the genesis of the private wing in Lira, which now makes the 3rd year. So when we initiated it, the critical area that was able to generate money as fast as possible, where even in this questionable money, really it went to the running of the pharmacy, which is the private pharmacy. And it's like you place the orders and then have the medicines that are able to be sold, and it operates 24/7. So the game changer was that from the collections from the students, we now had a solid engagement of having what? The private wing. And one of the key generation areas for revenue was the pharmacy. So with that now coming, that is now how we had to begin saying, how do we ensure that we have medicine? Remember, this medicine doesn't come from national medical stores. It comes from joint medical stores and other pre-qualified medicines suppliers. And that is the story. Actually, this money we're talking of really was so like we have sold the medicine and then
we don't justify
the procedure
is what
followed.
We really agree, as it has been alluded. You know, when you are trying something, it is a mistake you make. But in order to see what do we do, and right now as we stand, actually from the set of it, one, we got on to digitalization, where no money would pass through anybody, but would be collected through the system. We got in a separate accountant and whatever, and that was what was running. Now with the coming of URA, we don't touch the money. Not anybody touches. Before you get a service, before you get the medicine, money is paid to who? To URA. So we no longer interact with that.
That is noted. We thank you for being innovative by having a private wing. Make sure he said the standards are still somehow low. We pray that you improve them, because your people got money for parish development model.
Yes.
So with the rise in incomes and of the household, they will be able to pay for the private wing will be lucrative. So they get PDM.
Well,
so the fact that the private wing is a game changer on your side, the other ones also got a game changer. So it will be lucrative time to come in the future. But the whole thing we are speaking to is once the fact that you've appreciated the mistake, we need to ensure that every money that is collected at the hospital should be channeled through URA. Honorable colleagues, we go to
eyes on, hands off.
And that is it.
But they can have that latitude, but once they get authority, there are some cases which are exceptional circumstances. You ask for.
Actually, Madam Chairperson, just for sharing of information, when we began running this, we actually tried to also develop guidelines for the running, working together with the board. But the Ministry of Health issued guidelines generally for running private wing services. I don't know whether I would say unfortunately or fortunately, those guidelines have been rescinded by the ministry for further review. But one good lesson we've learned is, since we had already started the process and already gotten URA engaged, we are already comfortable with the way the arrangement is. No
okay, we go to audit of the usage of and maintenance of medical equipment. Honorable colleagues, the auditor notes that we have idle equipment, and when you go to Appendix 5, these equipments are what is this? Defibrillator, central patient monitoring unit, neonatal ventilator, ICU compressor boots, a mobile X-ray, and a monitor. Why are these machines idle, sir?
Thank you, Chair. Most of these equipment were brought at a time, the regional referral. I think that was around actually COVID time. At that time, we did not have anesthesiologists. Running of a critical care service requires the expertise of an anesthesiologist. At that time, we didn't have. Now, I mentioned in the beginning that we now have an anesthesiologist at the hospital, and that's why we were able to have the 3 beds of the ICU functional, because of the presence of that specialist. Those medical equipment are now being utilized, unlike at the audit time.
So the reason is very simple. The machines were brought without adequate personnel.
Yes.
They had the other advantage. The advantage continued growing of the minister, giving everything. But
For how long
the only challenge was on manpower. I am now believing why gender could not win health in Lira. That's factual. And if I met gender, I would have told her by that time, please go back to where I am. Otherwise, the way they brought you things, it was an advantage.
It was
so
all regional
hope we no longer have idle equipment.
No, we don't have any more.
You know, when you get advantage to access of some of these facilities, put them to good use, because seasons change. You never know. Yes.
Relieving my sentiment about the election, the other question we have to put to Minister of Health is buying those equipments, sending them to these regional referrals. without preparation for them and the manpower. Because incomplete, maybe for them the issue is buying, and the recipients, for them whatever comes, they have to look for space where to put it. Whether in their sitting rooms or in the director's office, they will keep their things. They must receive. How do you reject? And we shall need the Auditor General to take a keen interest on how much is spent on buying such. The desire is there. But you can have something desired useless and rendered useless if it has no manpower and operation. It becomes the negatory expenditure. But at the top, for them, they have.
So some of these were ICU staff and you didn't have equipment. I mean, the ICU equipment, you didn't have staff.
Yeah, we didn't have staff. Chair, the unique thing about anesthesiologists is that in this country there are very few.
Okay.
I think, I'm not sure about the number, but the fact that we struggle to recruit them is just enough to justify that there are not many in circulation.
They can, Madam Chair, they can even be there, but how much are you paying them? Actually, there are so many experts taken out to train in such fields, but on return, where they go, they find that I found some in Ghana. They said, we can't go back to Uganda. Do you know why? In Ghana, they look at their enumeration. They also need them, and they are trained from there. They are going to give them status. They are experts. They stay. But our intention and interest is to see you have taken them for training. Government has spent money. How do you remunerate them back? The moment you don't have that, you will get challenges. We know what is happening in the Lira University. Still, the lecturers don't want to come there because they look at their payment. Some of you who are in Lira and you are born in this way in Kampala, Kalungu, we give you positives because you are the real professionals. In the teaching,
yeah, the real patriots.
Yeah, for us in teaching, they were asking us the first question before you are admitted. If you qualify, where do you want to teach? Minute upcoming training, you say, I want Kampala, Masaka. No. Then the externals will say, this one cannot be a teacher. But they say, if we qualify, we don't teach in any part of Uganda, you enter the college and you train. Because you have shown you are.
Yes, Honorable.
Madam Chair, yesterday when we had a team from Barara, they indicated to us that they are supported by the university. And I've seen all these universities are almost everywhere where the hospital. What is your relationship with the Lira University as far as support, complementing what you are doing in this aspect?
Thank you very much. We do have a running MOU with Lira University, and the MOU focuses on sharing the human resource skills that they have, because their students come and learn from the regional referral. So their staff are supposed to be part and parcel of the duty rota of Lira Regional Referral Hospital, and they cover treating patients as they train. The other aspect of collaboration is that one of the spaces that we have had expanded in the hospital was actually built through that partnership. We have had an extension of gynecology department, and this has been because of that collaboration they offered to do that for us. So our working relationship is good and it's growing.
Yes,
you could educate me. You know, I've been in education for so long. Either it is the Soroti or Lira University which has challenges. Could you hear the past? They were saying they also want to build their own hospital at the university. And the problem was on administration of the hospital. Could it be you or the other side?
Lira University has their teaching hospital.
Lira has their teaching hospital?
Yes.
So the other one is in Soroti?
I think it's Soroti.
I think which has that. Okay.
Yes.
Okay.
Thank you.
Do you normally get intern trainees?
Yes, we do get interns.
How many can you accommodate?
34.
34.
Yes.
So how do you remunerate them?
The Ministry of Health has a budget. Their payment comes through Ministry of Health to the regional referral.
So 34 is the capacity you can accommodate.
Yes.
Do you give them accommodation?
Some.
How many?
I think it's about 40% of them.
40%. Okay. Honorable colleagues, we go to this inadequate medical equipment. Much as we have idle equipment here, then we have inadequate, where the auditor noted that the CT scan handles 50 patients per day, above the current load of 20. The auditor was further informed that in instances of breakdown, the CT scanners in the surrounding areas, such as Gulu Regional Referral Hospital, patients are referred to Lira, which increases the demand for the services. So this CT scan serves which kind of area?
Thank you, Chair. The CT scan is one of the advanced radiological equipment used for giving finer details of the body through imaging. In the past, we experienced inflow of patients from the neighboring regional referrals, and that usually happened when they have a technical challenge with their machines. So during that peak period, we have a high volume of patients seeking service for CT scan. But in the recent months, we have had a stabilization in this area where Gulu, they provide CT scan, even Soroti, they are well covered. This is an area that we will continue to observe and engage Ministry of Health from time to time.
The inadequate staffing to operate medical equipment, for that we take the CT scanner, how radiologist, radiographer, medical this is a what? A physicist, engineer. Now, what's the update? Do we have this stuff now?
We do. Right now, we have 2 radiologists on ground and radiographers running CT scan and other imaging services.
How many ambulances do you have?
We have 3 functional ambulances.
Which type?
One is type C, and then the other 2B.
The other 2B, are they fully functional?
They are functional.
He has 3, and he said all of them are functional.
Yes. No, we don't have others now. Although regional referral manages all the ambulances in the region. Yeah.
So for you, we take note that at least you have no challenges of the budget, inadequate budget under supply of medicines and medical supplies, others.
That is not true, Chair.
That's not true.
Yes.
Somewhere you told us that you had excess medicines. That is why the private wing could not sell drugs.
No, we didn't say we had excess. It is that we have had an increase in the budget for medicines, but still is not.
What is
adequate.
your budget for supply of medicines?
Our current budget is 2 billion, and
what would be the adequate?
What would be adequate is about 4.6.
4.6 billion.
I was asking my neighbor here, that ambulance class C, what is its type? Is it a Land Cruiser? Is it a Toyota? Why I'm interested with the potholes. Could you educate us on that? I know what is inside the ambulance, but is it a Land Cruiser? You know, Land Cruiser is better than a Toyota. This minibus. No, you NRM member, wait. I'm asking a question to the accounting officer. That's a light moment. But could you educate us? Because for I want to know.
Yes, thank you. Thank you,
about.
Honorable. The Type C ambulance is not the other hard body Land Cruiser. It is, of course, a Toyota. But it's in that form of a drone taxi. Yeah, so the bigger one, more of like ballooned. Yes.
Cool.
Yeah.
Can
So-
you afford the Type C?
Yes, it's actually a mobile ICU. Yeah.
But
Okay.
maybe- I was saying maybe something to note as a difference between these two ambulances is that the ambulance we are talking of is a purely highway ambulance. It is not for these corrugated pothole. It's for like from Lira to, say, Mulago. Not like going to Olilim or to a room. That is where the Land Cruiser does it. That is, yeah. Otherwise, if you put it on those roads, it is not for it.
Then this failure by NMS to replace expired and obsolete drugs.
Thank you, Chair. Pharmacist?
And why do we have expired drugs?
Yes, thank you, Chair. On the issue of failure by NMS to replace the obsolete drugs, at Lira Regional Referral Hospital, we have the verification committee. Usually when our medicines arrive, we verify our medicines vis-a-vis the delivery note. After that verification, we verify for quantity, quality, checking on the expiry and conformity. So where the expiry is less than 4 months, 3 months and below, we do not accept them. But these particular ones were actually having a very, very low shelf life. So we usually fill in a discrepancy form. And in the discrepancy form, we state clearly the reason for rejection, and we give it back to the driver and send it back to National Medical Stores. Now, after sending these drugs back to National Medical Stores, in the subsequent supply, they usually bring a replacement. But we've also seen scenarios where they fail to replace these obsolete items. We still keep following up where they give the hospital actually a credit note on that basis. So for this particular one, it is still something we are following up with them.
Yeah.
Yes, Honorable.
Can we be given good information on this? Do you get the drugs you seek for from NMS as you apply for them, or sometimes they give you drugs which are not required by you? Because sometimes that causes having expired drugs. When they bring them, they don't take them back. But if for consumption, you don't need them. For example, one time we had them in Kalungu. They give us drugs for elephantiasis when the problem is not there. Nobody is suffering from elephantiasis, and we have a lot of it. Because the issue of expired drugs is very costly to government.
And,
so we need to know the procurement of the requests you make. Are they responded to as per your orders?
Doctor, if you are to be a little creative in this, my assumption is that when National Medical Stores is doing a delivery or making a delivery, there is somebody on your part to receive. Do we have a way of, I don't know what is put on the invoice or the delivery documents, but is there a way of detecting some of these dates at the time of delivery? Do you know why? You mitigate, number one, the risk of double handling. Number two, most of you have been complaining about issues of space. So why should I receive some drug that has a short shelf life? if it won't be accepted by the hospital, we must have a standard. So, you know, this kind of receive them, write them to pick them, it is costly on either party. Because at the end of the day, NMS is also in business. How do we do it, I mean, in a more convenient way to either side? Because for you, you receive something that is soon to expire, you won't dispatch it to the patients, you see? So you will have a shortage on your part. Somebody asks for it, you will not give. That you will say, I don't have. So just in case if the NMS had returned it at that very time, that means you ought to have gotten a replacement a little earlier. And if you do it like that, NMS will also learn a lesson. Because at times it's done deliberately. They know because you are government, I mean, they do it, the remedy is limited. Because if it was for your private business, can you accept such operation? Obviously not. That's why at times you are told, you know, operate government as if it's private business. So I think, Doctor, we can learn from that. Why don't we develop a method of ensuring that anything that has a short shelf life, should it be allowed in? Get a way of, I mean, having this returned at the time of receipt of the drugs. Because that will help us in all these things of, you know, because if one hears of an expired drug, how? In this era of shortage and inadequacy in resources, why do we receive things that are soon to expire?
Thank you, Chair. And indeed, if you look at this issue, that delicate process contributed to this figure being detected, because we have a system that monitors what comes and what we should receive. So we have been rejecting this on delivery and sending it back to national medical stores for reconciliation, so that in our next cycle, this figure is still taken care of as we are getting another cycle. Yeah.
But that thing of the reasoning of they will cater for it in another cycle, that is also abnormal. Because
there's demand, people are sick.
Yes, there is demand.
Why should it wait?
Why should it wait for the next cycle? We need the drugs. So that means in the next cycle, you'll have excess.
The cycle is the quarter. They deliver quarterly or
2 months.
every 2 months. But that is
months.
still a long time. Someone would have died.
That for these 2 months, you will not receive this type of drug, then you will double. Or we shall replace with something. Somebody is losing out on a service. You see? So I think we should, let's learn from some of these experiences so that we can do better. Because if I want ARVs, can you tell me, you know, it will be supplied in the next cycle? Then I mean, I'm being denied the service. You see? So some of the things need to be considered.
But I think, Chair, that's where, of course, they have the obligation to demand from NMS to make it good, these expired drugs within time. But I think also on our side, when we are writing a report, the recommendation is that National Medical Store should not have to wait for a second cycle when drugs that are due to expire have been sent back from the referral hospital. They should be able to place immediately.
These drugs are paid for. It's not a free service. No.
Yeah. Even if they are donated, why would they accept donated drugs which are about to expire?
And sometimes, you know, I hope it is not with the leader. You might have the drugs and they are not issued out to the patients in the stores. It used to happen, by the way. And let me tell you one thing. In some instances, we take expired drugs. But depending when they expire, because once you don't have the drugs, there is no remedy. It expired last month. Like now, you think my mother, the drugs I gave her last year, hey, she's there. Sometimes you say, my headache. She picks one of that and she survives. Yes. But of course, by accountability, it's an issue.
Yeah, and maybe a small response on that. That comes when we do not do proper procurement planning. And for us as Lira Regional Referral, we have a medicine and therapeutic committee that analyzes the disease burden in the region and what kind of conditions are consuming which antibiotics, fast-moving drugs. And that is where we concentrate our budgeting to. So we do not have scenarios where you have idle medicine within the hospital.
Out there maybe there, but small, minimal,
can be
minimal
minimized.
figures, equal to plus minus,
Yes.
yeah.
Okay.
Error.
Stores management, inspection of the stores. The auditor inspected the stores and these were the findings. The store experienced high temperature above 30 degrees in the store during hot seasons. There was insufficient storage space for the drugs, leading to placement of drugs on the floor. Inadequate fire extinguishers, which may lead to increased fire risk. Inflammables like alcohol and sensor were stored together with drugs. It was also noted that some drugs were stacked more than 6 layers of boxes. In such circumstances, there is a risk that EMHS could be exposed to conditions that may lead to damage and privilege. There we are.
Thank you, Chair. Pharmacist and then PHA.
Yes, thank you, Madam Chair. I want to start by acknowledging that our store, the current storage space that we are using, is an old repurposed building that is not able to accommodate the growing need of medicines that we are now holding at the Regional Referral Hospital. The Regional Referral Hospital does not only hold medicines for the facility, it also holds other supplies for the whole region. So looking at the space that we have currently, we are not able actually to maintain temperatures within the required range, which is not really safe for our drugs. And one of the areas that we've been pushing so much is construction of a new store that can meet the need, especially in terms of storage for this medicine, so that we're even able to segregate these items properly. Because where you go and then you find flammable items like alcohol in the same space with other medicines, it is not really safe. In case of any fire, it could actually spark up a big loss for all of us. So the major challenge we are having actually is on the storage space, which is not adequate. But ideally, when we receive medicines, we are able to put them on the pallets and put them on a few of the shelving that we have. Thank you.
Yes, Honorable.
Madam, through your accounting officer, you are lucky you gave us black, you got black and white. If it was colored, you would be seeing the truth of the challenges you have in your store. You might have a small store, but you give it good order. Because they say there were drainage channels around the store. However, there were no gutters, which led to damage of the fascia boards and siding of the store, which hence damaging the building. Now, this is the maintenance. However small your space is, but the care and maintenance of your store is not good. Before you get the other bigger one, why don't you prepare some budget for making your store where you keep the drugs very clean? And when you look at this picture, you can see that there is some disorganization. So thank God the one who gave us never used the colored. With the colored you save everything. Even you can see the insects moving within. So Mr. Accounting Officer, it's about management and the routine maintenance of your. There are areas you must give attention to as you carry out maintenance. This is a store keeping drugs.
Yes, Honorable Bangula.
Thank you very much, Madam Chair. Two things. One, considering the stocks that seem to be congesting the small store that you have, you really need to tell us why people keep complaining that there are no drugs in public facilities like this one. So who consumes these drugs? That one you will have to give an explanation. But also directly in relation to stores management, we have two common aspects that guide us. One, the layout. It helps you take care of two key aspects. That is one, LIFO, anachrome of last in, first out. Because there you are able to know how your stocks move. It will also go on the other aspect of FIFO. You might have drugs that you may need to pull out first, first in, first out, and then last in, first out. Those are key aspects of stores. So a disorganized store cannot enable you achieve one of those cardinal demands for any management of stocks in the stores.
Honorable members, Honorable Mudimi, you have something?
No, Madam Chair, I want the accounting officer to educate me about these advances. And when you look at page 9.
Honorable Saunga, as I take this call kindly, Chair.
Prepayments and advances. Note 22A. So what are those ones? Note 22 on page 27. Advances.
Accounting officer. And you note my tone is going to change. I'm going to speak like a lady as I chair. Meanwhile, she comes.
On page 27 of the accounts, note 22, prepayments and advances. These are in respect of what?
Okay. I think let me start from the accountant.
Thank you, Chair. Through the accounting officer, these are other prepayments. This was the prepayment we talked about electricity. A prepayment for electricity.
This in respect of electricity?
Yes.
Okay. Now, okay, if that's the case, now I've seen here. It is there. Here. Now, I've seen several bank accounts. Stanbic account 48. I'm reading the last one. 482993. Stanbic 822028. Then Bank of Uganda. Now, these accounts are in respect of what I've seen the balances on it. These one are in respect of what?
Accounting officer.
The attachment, I've seen the reconciliation and the statements.
Accountant, clarify.
Thank you, Chair. The first account, 903-000-625-0482. That one is used for interns, for payment of medical interns.
Yes.
The funds are sent from Ministry of Health, and the list is also sent.
Then the second one?
The second one is used for cash in cases of like cash impress. That is the hospital account. Then the third one is used for non-tax revenue. Actually was. Currently it's now not in use.
Yes. Save the one of cash which is you've disclosed. The rest, where are they? In the accounts. I've seen the one of cash 822. Not 21. The final accounts. Where are the rest?
Yes, I wonder. As he comes in with that answer.
No,
maybe, yes. What, this is just in addition to what he was asking. The prepayment, my concern is what was the basis for the prepayment? Because in the normal practice, and ordinarily for such a utility, they first bill you before you make payment. What informed this advance?
Thank you, Chair. I think I'll start with the last one. The prepayments, yes. The prepayments was due to
it was made to UEDCL or MEME previously, because we were given yakas. A yaka is paid instantly. You pay and you consume. You don't consume and pay. Yes.
Okay. Honorable Elijah, as I am about to hand over to the...
But I asked him about the balance.
Yes, the balance. Because before he comes in, okay, then you first, let us first an answer, then we shall send back.
Allow me bring your attention to page 42 of the financial statements. It's a schedule of projects and subvention balances. So all those accounts are for projects and subvention. Meanwhile, on IFMS, the ones we've captured on the financials, we are using the Bank of Uganda single treasury account.
Okay. Madam Chair, I'm returning back to you.
No, but sir, you see, this is a schedule, but you see, if one wants to read a reader without going into this, should be somewhere even the comment here. Why you've left it?
Thank you. I understand we are supposed to put it on the commentary of the head of accounts, but we skipped. But the next time we shall put it there.
So you are maturing now.
Good, yeah, his response is good for us. I want to accept that is fair. Honorable Elijah, then Honorable.
Yes, Mr. Chair.
I send back.
I'm taking you to payables on your response. Where you are, this is in reference to the financial position under note 28B on page 9 of the financial statements. Payables amounting to 586 billion. The amount increased by 427 million rather. That is 73% increment. I'm just asking, does this increase, this astronomical increase of the water bill from 158 million to 586 million, showing an increment of 73%. When I read your response, management response, you say the increase in the area was a result of increased consumption from the newly constructed buildings over the years. Why? So if it was over the years, why was it not reflected in the previous year? Because 2024 is 158 million, but it was now 2025 when it's more. Because if it was over years, then it should have been fairly distributed. At first, I thought maybe because additional building in the year in question. But when I look at your financials on page 29 on construction progress, when you look at buildings, additions during the year is nil on page 29. So, can you explain the reasoning? Because now the other one is defeated if you said because of the new buildings. There were no additions.
Accounting officer, please be as fast because
thank you very much.
There's a question here and you want to.
Internal auditor and accountant.
Thank you so much. Now, in the year, I think 2024, 2025, there are some projects which had started construction and it got finished in the beginning of 25, 26, and some actually got done in 24, 25, including the satellite dispatch center, the satellite laboratory, remodeling of a theater, and the oxygen plant. They all got completed in 2024-2025, and with now the starting to use the buildings, the consumption increased from the average of 420 millions we use in a year, it shoot up.
You know, but you see, I don't see it in the addition of the structures. You go to note 26D, buildings and structures, because it should be reflected there. If that's the case, where are you reflecting those?
Yes, accountant, if you may summarize.
Yeah, because if it were because of the additional buildings, it should have been reflected here.
If you don't have the answer, you tell us and you can give you room to give us proper answer than fidgeting with it. It's okay.
Thank you, Chair. The additions, it was because it wasn't complete and handed over to us at that time. And most of those buildings were not constructed by us. That's
Excuse me, if they were not handed over to you, why were you paying the water bills for the houses structures which are not handed over to you? Because that's what he said, that they increase the water bill. You are paying for what?
I request that maybe you give us time and we find out.
That's better. That's better. So, Honorable Wangura.
Yes, thank you very much.
I hope the clerk is noting that.
But I hope you have picked my issue and make very
Thank you, and thank you for being a good chair who doesn't say Entebbe Woma. It's good to all.
Please, I'm still. Chair has given some more minutes.
Thank you.
He has refused to hand over.
No, he wanted to hand over immediately, but yes. Accounting officer, you came in after we had an engagement with the team from Masaka and Jinja. And one of the key concerns that we're raising is today you're seated there. We are equal also seated on this side. It comes a time when we are expected to exit. People retire. And when they retire, they have been your colleagues and they start pursuing what is due to them like there was no yesterday to remember that they're your colleagues. So here, when I look at your statement of appropriation, you had the budget for compensation of employees, which was employees generally, not yes, which was 13,533, but the actual was 13,099, which means you're not able to absorb all that you had. But now, you look at your statement of outstanding commitments. That's on page 38. You had outstanding commitments of 158 million. And yet you had the resources that were available on the other side. Nothing, no commitments were made during the year, but instead you accumulated further areas going up to 427. So really, for heaven's sake, have you not mistreated your own people who deserved to benefit from these resources? Aware that even what you had, you are not able to absorb all. And in that under absorption, there was 524, which should have at least offset the areas of 158. Can we maybe get an explanation to that effect?
Yes, accountant.
Thank you, Chair and Honorable.
Chair, you look here. I'm still enjoying the seat.
Oh.
Yes.
Thank
Otherwise
you, Chair.
You are. I'm about to hand over, sir.
I apologize.
Even it is live, you see, it doesn't go off.
I apologize. This is
No problem.
a typing error. It is the same areas for water.
Same areas for water?
Yes. It is the one that had 158. It was just typed in a wrong line.
Are you okay with that?
So this could not go in the correct line of utilities?
It could go, but this was a typing error and I will always endeavor to correct.
Okay, like I said earlier on, that we're expecting continuous improvement and growth from your side and supported by you. Thank you.
Madam Chair, I want to hand over. We are handling.
As I pass this one, this should be the
She is going to give you the room. Now I'm about to hand over. We are handling accounts, bank accounts with Honorable Dimi and Honorable. Yeah, but I want to put this on record as well, that we have been these accounts were always being, bank accounts were discouraged, and this is the first time I'm seeing more units having a number of bank accounts, and I think that's why Honorable Dimi raised that issue with even outstanding money on them. They have discouraged that. It must be running, I think, one single account. Treasury single account. So it might be kindly correct. Madam Chair, thank you very much. I can hand over back to you as I change my tone to the normal one.
Mr. Chairperson, sir, thanks for taking us through that session. Honorable colleagues, this side and this other side of ours, we have Muslim colleagues, and they need to go and do shopping for the family. It's not too late.
Just one clarification.
At least in a second.
Thank you, Chair. Again, on the accounts, on the non-produced assets, specifically land, how come that you have the same value every year? I saw land appreciates in value.
A response?
Thank you,
2.9 billion, 2.9 billion every year.
Thank you, Chair. We are continuously going to engage the chief valuer, government chief valuer, to see that every day land is valued. But for this,
professionally, is that right? Professionally,
it is wrong, but I cannot put in my own figures. We have to get the figures.
Now, what's the credibility now of your accounts? Because in the end, Minister of Finance consolidates all these accounts. Now, if you give wrong figure, then we shall end up also having wrong.
You understate the assets, public assets.
Do you know what the effect of understating the assets?
I know.
So why do you do it?
Honorable colleagues, thank you.
Land of Akibo. What was the problem? I saw it somewhere.
We are looking for funds to apportion in the budget to fence the place. I'm sure we're going to fence it.
Before you fence, put a disclaimer on that land. That's what normally happens. You have no fence, you can caveat, but a very big signpost. This land is not for sale. Belongs for the referral hospital.
Honorable colleagues, we need to go back to Lira. Accounting officer and your entire team, we want to thank you for this engagement. PAC is not here for fault finding. Our duty is to ensure that the people of the Republic of Uganda get services, quality and standard. You know, normally people think that getting standard services in our country is a favor. No. Actually, we should always offer an apology every time we don't deliver up to the expectations of the people. So the reason as to why you allocated funds is to ensure that you serve the people. So we implore you to always do better. We believe in continuous improvement all the time. I want to thank you for, first of all, you kept the time. We thank you for the performance so far, but we believe we can do better. For the ladies this side, whenever you come before us, we encourage you to be professional. You know, whenever a mother holds a position, the belief is we are never corrupt. You know, we are good at time management. Perfection on the side of ladies is expected 100%. So kindly take good use of those spaces so that the girl child can always, take advantage of such. Because whenever we don't behave well, you will be pushed out of the system. For the boy child, for you expect it to be professional. So this is our country at the end of the day. For us, we normally tell people you can't be everywhere. You are at Lira hospital, you will need the services of a lawyer. You will need the services of a leader. So what you give, people will reciprocate. So let's make sure that we do what we can. You know, no one is perfect. But at times there is what we call a limit. Let's serve humanity. Our colleagues from Angura's side speak about protecting the gains. Though, for me, I will not tell you that I am in for for that slogan, because at times we have nothing to protect, but we can't say we have nothing, even if it's a saucepan and a spoon.
That is what
it is again. That is what
you protect what you have. Yes.
That is what you have, and it's again. But at the end of the day, when you come to such committees, for us we are non-partisan. That's why you'll find that most of colleagues here belong to the party of the yellow banana. But we are very non-partisan. Then, he's saying it, that one. But sunflower, but as you are aware, blood is thicker than water. Red always dominates, but those things don't work here. Honorable was asking, Honorable, as you are leaving out, why is Seungu chairing? It always comes back, nope, but those things don't work here. They don't work. So we want to encourage you to serve the country. Elections have ended. Please, when people come for services, don't normally people tell us, when you belong to this political party and you go to a hospital, the way we are looked at. I don't believe that the people of Lira can do that. We are all taxpayers. We all deserve access to some of these services. We wish you journey masses as you get back to here. I was thinking about what to give you because tomorrow is Eid. The only thing I can say is Eid Mubarak. I'm going to pray for you. But they are going to get in touch with the clerk. They will send those documents. So wish you well, Eid Mubarak, for some of you who you already got salary, isn't it? If not, somebody told us that in Lira we have money lenders. You just take an identity card and they give you money. So if you have your ID, no, but all teams have been smart. No, I think Masaka was the best. Masaka was, you can't, but no, it's not conflict. But you know what normally happens when people come here and they are not fit to be in this place. So you are dressed parliamentary. It's not that you should come and compete for these seats. Voting has ended. You can. No, we still need them this side. We still need you this side. But colleagues want to appreciate you. Lira is an area that used to be very trusted. The northern people in the north don't lie. Though these days things have changed. Things are purely different. I don't know who was spoiled to you, but not you. The team that came here was very genuine. So we want to thank you, General Masses. But don't don't move to Lira in the night. Accidents are many. Please sleep around. You have a vote for welfare, and Serena is not very expensive. Once in a while you have where. Honorable Gonzaga Seungu is going to see you off. We still have some tea. Please, you can take. Work smartly to Lira. There is nothing we can give, but at least prayers for good health, for general mercies, and for a better future as we look out to serving our country better. Thank you. Meeting is adjourned. Eid Mubarak.